Since we're spending a lot of time talking about the liver, I did want to give a bit of information about the use of divalproex or valproate in people who have liver inflammation in particular. And the reason I choose that language very carefully is that this is often a concern because, as we know, divalproex or valproate itself can increase your AST or ALT. Again, these are the same drug. When you ingest divalproex, it becomes valproate in your system. But we have a lot of people out there who drink. We have still some people with untreated hepatitis C. We have folks with non-alcoholic fatty liver. And these are the people who are going to come into your clinic with an abnormal AST or ALT, just like the case we've been talking about. So valproate is an interesting drug because it is highly protein-bound to albumin and prealbumin. The free fraction is quite low. With a serum level of 40, it's only 10%. But as we increase the serum level up to 130, the free fraction increases to 18.5%. And not surprisingly, all of the effects of the drug, both good and bad, are mediated by the free valproate level. In general, we don't separate the free fraction from the bound fraction. This is only done in certain unusual circumstances. And typically it occurs if you have another drug which is highly protein bound, like another anticonvulsant, where you're worried the free fraction may be too high, even though the total level may look normal, or if you have patients with very low serum albumin. In those instances, there's simply not enough binding sites, and the free fraction will be much higher for any given total serum level. In those unusual circumstances where you might want to order a free valproate level, there is a therapeutic range, and it's 7 to 23 microgram per ml. Again, the total, which is what we normally order, is 60 to 120 microgram per ml. We normally don't order the free fraction, as I said, but there will be circumstances you may run into where you have to do that, and it's good to know what the reference range is for free valproate levels. So valproate has a half-life between 9 and 16 hours. There are extended release forms which can be used once a day. It's an interesting drug because it's actually hydrophilic with a low volume of distribution. And the net result is that the kinetics are not linear. They're actually what's called sublinear. At higher doses, the higher free fraction tends to stay in the plasma compartment and then gets cleared by the liver. So time and again, I hear from individuals who say, I increased the valproate dose by 50%. How come the level doesn't go up? And I have to explain to them it has sublinear kinetics. The patient could be non-adherent, which often happens, but it's often simply sublinear kinetics. There are a lot of contraindications in the valproate package insert. It's an old package insert, and sadly, a lot of the language is vague and alarming. There certainly are some absolute contraindications. People with certain unusual mitochondrial disorders or mutations, most of which we never see, children under the age of 2, obvious allergies to valproate, urea cycle disorders, those who are pregnant, and those who are of childbearing potential without effective contraception. But the package insert is very vague. It says Depakote should not be administered to patients with hepatic disease or significant hepatic dysfunction. And this is the core of the problem. This is old, outdated wording, but it will never change. When I put together this lecture, this language still persisted in the 2020 package insert of Depakote ER. No parameters on what they mean by hepatic disease. Are they talking about cirrhosis, inflammation? And it's caused a lot of difficulties for clinicians. So a couple of points here. Again, divalproex is what you ingest, but it becomes valproate. You can also give people valproate directly as well, but this is a highly protein-bound drug. Most of the time, we just get the total level, and that's fine for patients who have normal serum albumin. But if you have very low albumin or you're on another highly protein-bound drug, there will be need to check the free valproate level. All of the effects, good and bad, are mediated by the free valproate levels. It is clearly contraindicated in advanced cirrhosis, but given that vague wording in the package insert, the clinical question, which we'll discuss, is whether you can use valproate in people who have hepatic inflammation without cirrhosis.